Question 7, Honourable Member for Garff, Mr Perkins.
Thank you, Mr President. I would like to ask the Minister for Health and Social Care how long a person has had to wait from a first appointment with their GP to having a cataract operation in the last year.
I want the Minister to reply.
Thank you, Mr President. The Department of Health and Social Care systems and processes are not currently set up to record and report waiting times for cataract surgery in the format requested. Waiting times for day case procedures are currently published online quarterly, of which cataracts form the majority of the day case activity for ophthalmology. There are currently 92 patients waiting between 0 to 2 months, 118 patients waiting between 3 to 5 months, 337 patients waiting between 6 to 11 months, 262 patients waiting between 12 to 17 months, 104 patients waiting between 18 to 23 months, and 15 patients waiting greater than 24 months. The loss of activity experienced during the first COVID-19 outbreak on the Isle of Man has impacted on waiting times, and the Department is currently reviewing options available to reduce the current waiting times for cataract surgery. As part of the service-by-service design element of the health service transformation work, 5 pathways have initially been identified to look at current services, establish any service gaps and redesign the service to reflect patient need in that area. Eye care is the first of those pathways to be developed, although others are in progress. Progress has been made in that respect, with redesign of the pathway almost complete. The next steps are patient engagement to check the design along with the implementation of the changes required. These include, amongst other things, the provision of a minor eye conditions scheme, meaning that patients who have problems with their eyes will be able to receive additional services from local optical practices.
Supplementary, Mr Perkins.
Thank you, Mr President. I'm very pleased to hear that. It's very good news, because I think the members of the public are concerned about certain things that have slipped through COVID. I've perhaps been overtaken a bit by events, but has the Minister looked into the fact that we have a operating theatre in Ramsey Hospital that in the past has been used for elective day surgery? Can we include that perhaps in the plans going forward?
Minister to reply.
Thank you, Mr President. We have looked at that, but I believe my understanding is that isn't practical at the moment in relation to the way they're set up at Ramsey. One of the things we are looking at, though, is to bring in additional resource. And another thing that the department has been looking at, because we've spoken already this morning about referrals into the UK, let's not forget, although things might be changing at the moment, again with the worldwide pandemic on the go, we have another near neighbour the other side, the Republic of Ireland. So we have been engaging with the Republic as well around what support they can offer, but we have also been making endeavours to bring additional resource in to try and reduce the waiting lists. And although I can't announce anything at this current moment, I'm hopeful that we will have some success in that area.
Supplementary question, Mr Speaker.
Thank you, Mr President. Does the Minister stand by his commitment made on the 23rd of October 2018 to have an 18-week referral to treatment targets within 5 years? That was 2 years ago. He's got 3 years left, and we've still got people waiting over 2 years, never mind 18 weeks. At that sitting, he also said that there is an assessment underway of increase in activity performance and associated capacity. Are the results of that available for Tynwald members, please?
Minister to reply.
Thank you, Mr President. I do stand by the 18-week referral to treatment. We were perfectly honest and said it would take about 5 years to get in place. Obviously, COVID has not helped with that, I'll be perfectly blunt. But no, we do still stand by that, and we are still working towards that within the department. But as he states, we're just about halfway through, and certainly cataracts is one of the areas, along also with hips and joints, that we've got a real pinch point that we need to work on. In relation to the outcomes, I will see if there's anything I can share with Tynwald members, Mr President.
Honourable Member for Onken, Miss Edge.
Thank you, Mr President. And I'm sure the Minister's aware we've had quite a lot of communications with regards to cataracts and people waiting. Obviously, he's aware that I'll say it's my mum. She's been waiting way over 2.5 years for a cataract operation. I've been in discussions with the Minister, and he assured me that the lists were going to be back to pre-COVID levels. This was in August, and that there'd be 4 lists per week, and obviously the list would come down, hopefully. Can the Minister therefore advise how many patients have been seen since the list started again and had their operations, and how are the patients being prioritised now?
Minister to reply.
Yeah, thank you, Mr President. Taking the last point first in terms of prioritisation, with the COVID impact, all areas have had to do this. They've gone back through their lists and reprioritised, because obviously over several months people may deteriorate at a much more rapid rate than others. So the entire lists have been gone through in every surgical area to decide if the priorities are still correct. In terms of number of patients, I can't give it that, but what I can say is we have been operating the 4 lists, and that we actually are at pre-COVID levels.
Ms Edge, further supplementary.
Thank you, Mr President. Does the Minister know how many cataract operations can be carried out per list? Thank you, Mr President.
Minister.
Off the top of my head, I don't, Mr President. I've got a feeling, I think it's 15. I don't know why 15 sticks in my head, but I will actually get that information circulated to members, because knowing me, I'm probably way off.